Morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. Believe it or not, the open enrollment is here. It is the ACA open enrollment, and also known as the Affordable Care Act. I'll expand a little bit more on that here in a bit, but we're in what we call in our line of work, it's the dual open enrollment, because on October 15th, we were able to start enrolling our folks in their Medicare plans, maybe changing their drug plan or change their Medicare Advantage. And I'm going to talk about more about that later. You know, if you've listened to me much at all, you know that my bread and butter is Medicare. That's my sweet spot. That's my niche, as they say. But today I want to try to focus on the Affordable Care Act, since it is the start of the open enrollment, and then next week go back to talking some more about Medicare things. We still have time. The open enrollments is, let's say, the ACA open enrollment is November 1st to January 15th, but we do have, call it a soft deadline, but December 15th is the deadline to change your plan to have your new plan start on January 1st. Most people, if you're already done through the marketplace, as we call it, that's the official name of it, is the Federally Facilitated Marketplace. It's also called FFM. And a lot of people, I've enrolled them 2 or 3 years ago, and their plan just renews every year, and everything works fine. And they don't call me up, or I try to reach out to them, and it's not a biggie. I still get paid if I enrolled them and they keep their plan. But this year, I think it's a little more important for marketplace plan members to review your plans. I've noticed there's a few changes. Maybe not as much here in the Upper Cumberland, but in other parts of the state, definitely, because I'm going to talk a little bit about the different networks and get into that. But the open enrollment, like I said, it goes to January 15th. So the problem is, if your plan isn't continuing next year, now usually what they'll do is they'll usually have what we call crosswalk. They'll have a plan, the carriers, I'm saying the insurance companies, the carriers, will have a plan that they're going to crosswalk you. So if you have this plan and it's not going to exist anymore, then they're going to automatically enroll you in this plan. And Medicare does that too. The Medicare Advantage and the drug plans will do that. They will switch you to another plan. Usually. Sometimes that doesn't happen. So we have ran into that. And the reason I bring that up, and that's one of the good reasons of having that deadline extended to January 15th, is somebody goes to the doctor in the first week of January and they tell them they don't have insurance, and they find out it was because their plan didn't continue, or they needed to update their income or something, and their plan just didn't renew for them. They need to go and pick a plan, so have it start, and so then it will start on February 1st. So they still won't have insurance in January if they've missed those deadlines. So it's very important. That's why it's very important to review the plan, get that taken care of by December 15th, and then you're ready for January 1st. So that's the first big thing about the open enrollment. And as I've mentioned on here a couple times, that we have 3 licensed agents in my office. I'm one of them, but there's 3 of us, and all 3 of us can help you with your Affordable Care Act plans. And I bring that up. The only one that's not licensed is Lena, which is our receptionist, doing a fantastic job. If you haven't called and talked to Lena, you're missing out. She's very professional, gets it done. And I bring that up because a lot of times people call, especially if they're clients I've had for a while, and they remember when I was a one-man show and didn't have a lot of clients, so I had a lot more time to take people's phone calls and answer their questions. I need you to help me on that. Is when you call with a question, tell whoever answers the phone what your question is, because a lot of times I'm not going to be available. So just saying, hey, I need to talk to Matt for a quick question isn't generally going to work. It's enrollment season. I am either presenting to somebody on the phone, somebody sitting across from my desk from me, or I'm about ready to start an appointment in 5 minutes, and I've got my mind. I'm trying to get those last minute things together before I make that phone call to that person who's waiting for me to reach out to them. And unfortunately, and if you've done it, and I know people have done it to you. The quick question is never just a quick question. So, but a lot of times, and even Lena, not being licensed, a lot of time will know the answer to what you're calling for. Maybe it's you just need a customer service number, or you call in and say, hey, I'm thinking about changing to this other doctor. Do you know if that doctor takes my plan? Now, I'm not expecting Lena to know that answer right away. And again, when it's Medicare, Kalia and Bree might, and even I probably won't know right away that, oh, yes, that doctor's in that network, but we know how to look it up. And that's one of the things of, even if it's Lena who's not licensed, you just tell her what your question is, and she can get one of the three of us to get the answer, and she'll follow up and let you know the answer, or one of the three of us then will follow up and tell you, your answer for that situation. Sometimes it's just, hey, I need it, I can't find my ID card. Again, when we know what your question is, we can get that to you. Sometimes I'll get, phone calls and texts and emails over the weekend, and it's some of those things. And that's something real easy to take care of if I know what the situation is. But just calling and say, hey, I have a question. Well, I'm going to get to you when I can get to you. But if it's at the end of the day and I need to be able to contact a insurance company to get your answer, we've lost the whole day getting your question answered, because the other members of my staff can call that insurance company and get your answer. So those are some things that they can help you with. And as I mentioned, Bree and Kalia are both qualified to offer the marketplace plans. They've both been doing it here, for the whole last year. So in Bree, a little bit, on top of that, both of them have been licensed for a couple of years, but the Bree has probably more experience with the marketplace. Then again, Kalia's our expert when it comes to TennCare issues, and because she's dealt with a lot of it personally, so she has a good grasp on that. So if you're wondering about, well, they say my kid can have CHIP, or my kid qualifies for TennCare, but what do I do? We can help you with that. So those are some things. And a lot of times, sometimes we can be a resource, even if you're just trying to find some answers out about TennCare. We don't have all the answers, and some of the stuff, that's something you might have to call TennCare and ask them the question, because it's very specific to you and it applies to your case. We can't answer a lot of those things, and with TennCare, we are not able to act on your behalf. We can be your agent, we can call the healthcare marketplace, we can call the insurance companies, but TennCare, you have to deal with the state. They don't talk to us. We can help you with the applications if you're doing that, but we can't follow up for you, basically, is kind of what I'm saying there. As I mentioned, we're in open enrollment, and we, have a tendency to speak in jargon and do abbreviations and things like that. I already mentioned once, I said ACA. ACA is just short for the Affordable Care Act. That's what was called, also known as Obamacare, and a lot of people still call it that. And I think what gets a lot of people confused is they think Obamacare is like Medicare or like Medicaid, TennCare. It's a plan. It's not. It's the law that said everybody had to get health insurance, and it laid out the rules of what is a qualified health plan, which affected group plans also, of not being able to turn people down for pre-existing conditions for a health plan. Now, there are health plans out there that are still underwritten, but they don't fall into that category of qualified health plans. So that's a little different there. A lot of times, if somebody, oh yeah, I want to get that critical illness plan, and they don't understand why they have to answer health questions, because it's not your health insurance. The rules didn't change for supplemental insurance. It's kind of like, well, if everybody has to have car insurance, but if you just got a DUI, you're probably not going to get car insurance. You have a pre-existing condition. It works kind of the same way. So it's that, that risk avoidance for the insurance company. So you are going to have to go through the health underwriting for some plans that aren't your major medical. And we've talked about that on other shows, and I may get a little bit more into that. But I kind of wanted to go into, as I mentioned earlier, I said the marketplace, FFM. So if you see ACA, FFM, Obamacare, the marketplace, FFM, as I mentioned, stands for Federally Facilitated Marketplace. That is healthcare.gov. That is the marketplace. And the thing is, those plans there are insurance provided by private insurance companies. So it is private insurance, But what makes it unique or different in that sense is you could get help paying for it. And the way you get help pay for that, you can qualify for the APTC. I'm going to throw some more letters at you, but they stand for Advanced Premium Tax Credit. So that's what subsidizes your monthly premium at the marketplace. So the plan might cost $1,400, but because of your income, you may have a $1,200 APTC. So that subsidy, that $1,200 subsidy, will make that $400 plan now a $200 plan, and that's what deems it affordable. So that's one of the cases that why you want to go through the marketplace. Earlier on, because I've been doing this for 10 years now, as you've heard me say, when people first do, I don't want that Obamacare, nobody takes it. And it's like, well, that's not exactly true. One, it's insurance. Now, some of the companies did have plans and still do that are only available through the marketplace. And so those plans are going to have a little bit a more restrictive network. And I'm going to talk a little bit more about that after the break. So just kind of keep that in mind. We'll talk about those networks and those things. They didn't want to fill out or answer the questions about their income. And I'm like, well, would you like to have help paying for it, or do you want to pay several $100s for it? And it's like, once I explain that to them, most people go, well, yeah, I don't want to have to pay $500, $600, $800, and I get them a plan to be $50 a month. And they're like, oh, okay, I get it now. So, yeah, you do have to answer questions about your tax household, and you have to keep that up to date. And again, always try to remind people it's an estimate. It doesn't have to be exact, but you want to be close. And one of the reasons you want to be close is the next year when you file your income tax to reconcile what you got for the advanced tax credit, you could owe money back if you underestimated your income. But bonus there is the reverse is true. If you overestimated your income, then you were entitled to more premium assistance, and you can get that back as in the form of a refund or a reduction of your income tax. If you've reduced your plan to zero, it doesn't matter if you earn less money. You're not going to get more back because you've got the full amount of your tax credit. So that's very critical of making sure that you are picking the right plan and making sure that's affordable. So I'll talk about this after the break. On the marketplace, making sure about your income and updating it. Now, if you're married, you do have to file a joint tax return, even if only one of you is getting the plan. And I know one of the things that kind of confuses some people, they think, well, I'm not making any money because I just lost my job, so I should get it, great break. Well, it's based on your entire income for the year. So everything that you earned earlier in the year is going to be applied for your tax credit. And again, that kind of works both ways for people. Maybe you've just started a job that's paying more, but they don't offer health insurance. You could get a very affordable health insurance because you weren't making as much money earlier in the year. But then you do need to relook at that when it comes to the re-enrollment, the time we are now, because now your income is higher. It's going to be higher for the next year because the last 2 months of the year that you were making more, well, now you got to multiply, those 2 months times 6 to get your 12 months average, or know if it's a salary, you're going to make $25,000, or you're going to make $30,000. Last year you were only making $20,000. Your subsidy won't be quite as good. It won't be as high. So anyway, we're going to take a quick break here and be right back.
This is Marvin Long, your Twin Lakes Business Solutions Consultant. Every day and on November 11th, Twin Lakes celebrates our veterans, the ones in active duty, in reserves, or retired, and the ones who've made the ultimate sacrifice. Twin Lakes will forever be grateful for the home of the free because of the brave. In honor of all our veterans, Twin Lakes business offices will be closed Monday, November 11th. Take the time to thank a veteran, not just today, but every day.
Looking for incredible deals and unique finds? Discover the Habitat Restore off South Jefferson Avenue in Cookeville. From furniture and home decor to appliances and building materials, we've got everything you need to spruce up your space, all at unbeatable prices. Plus, every purchase supports Habitat for Humanity, helping families build their dream homes right here in our community. So why wait? Visit Habitat Restore today and uncover treasures while making a difference. South Jefferson Avenue, right here in Cookeville.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, well, welcome back from that short commercial break. And we were talking before the break about the different subsidies and such for the marketplace. One of the things I run into a lot of, we always kind of want to make sure people know that usually it's kind of expensive for people to talk about, oh, my group plan's too high, I want to see if I can get that Obamacare stuff. Well, your family can. Well, generally, your family can, because most employer plans are going to be affordable for that employee, because the employer usually is subsidizing the employee's cost for that plan, and some will offer two plans. They have, just like we do on the marketplace, you have the bronze and you have the silver plans and the gold plans. And so they may offer a very generous, rich silver or gold plan. It's going to be more expensive, but it's going to have lower copays, lower deductibles, lower out-of-pocket, total out-of-pocket costs. Or they'll do the kind of the bare bones bronze plan. It may have a $5,000 or $6,000 deductible, some high copays for doctor visits, but it's generally not going to have a lot of rich benefits. But it is healthcare. It's going to cover your preventive. It's going to have a max out of pocket. So if you do have something catastrophic, that lands you in the hospital or something, or lays you up for several months, you've got health insurance that's going to cover a lot of those other expenses. When the marketplace says you have to determine whether your employer plan is affordable or not, it is based on the family size is going to be a percentage of the income, but it also is going to come into play or actually that's for the family, but for the employee, whether it's affordable for that employee is, I think it's 9.2 is the number they're using, that if it costs more than 9.2% of the employee's income, then it's not affordable, and then an employee can go on the marketplace and get a subsidy. Usually I just like to use a 10% rule on that. It's a lot easier to do the math. Kind of real easy. If you're paying $200 a week for your or not usually not $200 a week, but it's usually about $200. But like if you're paying $50, you get paid weekly. You're paying $50 every week for your health insurance. If you gross, and this is before any taxes or anything you're taking out, if you gross over $500 a week, then that's more than 10%. So you're going to be above that threshold of whether where it is deemed affordable for you. But that doesn't mean it's affordable for your family, because that's where it costs, because usually most employers aren't offering any assistance on the paying for the family members. So if you add a spouse or you're adding your child, a lot of times you can get something through the marketplace and get assistance paying for that, and it will cost less, and possibly have lower deductibles than that group plan. But the employee is going to need to go on that group plan. Or they can go on the ACA plan, but they're going to pay full price for themselves. So it really doesn't make sense most times for the employee to not take that group plan. We get a lot of people, my insurance is lousy, or it costs too much, and then we show them what the marketplace would cost them without any assistance, and they realize that their employer plan really doesn't cost that much. So that's some of the things for the marketplace. One of the things I've mentioned here before, I think I'm going to do it again, is because of all the bad actors out there switching people to plans, tricking them, luring them in with gift cards or free. If you call us, you'll get this $500 gift card and a 4-night, stay at the beach. And those are all just come-ons. They're tricks just to get you on the phone so they can switch your plan and get paid for it. A lot of the carriers and the healthcare marketplace have come up with solutions to reduce a lot of that, but the ads are still out there. You still have, they're basically stealing your information and just doing it only to make a buck. They're not trying to help you, and nobody's giving anything away for free, basically. But that being said, one of the things that we now have to have CMS, the Centers for Medicare and Medicaid Services, that's who governs all the health insurance things through the country, says we have to have a consent form to be able to act on your behalf for that healthcare marketplace plan, and we have to upload that into the system to show that we actually have your permission. The reason I bring that up is that's one of the things that when you are scheduling an appointment, and I think it's more frustrating for my existing clients than for new clients, because everybody's used to when you go to you get a new doctor, you have to fill out all the new patient forms. Well, we have new client forms too, and one of those is very important is we have to have that consent form. We can kind of start looking. We can start the shopping process. We can even, give you a quote. But now that you're ready to proceed and complete your application, we got to get that form signed and do that. So it just helps us to get that on the front end. And that's one of the things that, especially Lena or anybody who answers the phone when you call in and you want to book an appointment, we need to have you sign that form. And like I said, even if you're an existing client, maybe you even signed one for last year, they're only good for a year. So we're generally each open enrollment, we're going to go ahead and request to get a new consent form. And that way, things come up during the year, we need to update your file. We don't have to ask for it again. We have that. That's good for that year, and it's already in the system. So, work with us, because the two things that we ask you try to do is, one, fill out that consent form, and then we also have a form for collecting your information. So, so we can look at, you can list you can list doctors that you see, certain prescriptions, that you definitely need your prescription covered. But we're just going to ask, names and birth dates, get your address and email, all that, so we can build your online file and then work that. So when we have an appointment, we've got a lot of the housekeeping, as they say, is already done. So if you can cooperate with us and get those things filled out as soon as when you ask for an appointment, we can go ahead and schedule the appointment. But that's why and sometimes we'll say, well, if you fill this out, then we'll schedule the appointment, because sometimes people don't then fill out the form, and it just adds time to the appointment when we're doing it versus if we get the paperwork ahead of time. So one of the things I wanted to make sure I talk about before I run out of time is the health insurance networks and the type of plans. I think pretty much everybody's familiar. They've heard the terms HMO and PPO. And just a review on that, HMO stands for Health Maintenance Organization, which means it's managed care, and it's one of those, you have to stay in network. If you're going to use your insurance, you have to see a provider that's in the HMO network. PPOs give you that flexibility that you can see a non-network doctor and still get some help from the insurance, possibly paying for that doctor visit. Unfortunately, on the healthcare marketplace, and it's been this way now for the last 2-3 years, maybe even longer than that now, the years just kind of run together, we have what's called EPOs, and it stands for Exclusive Provider Organization. Works just like an HMO in that regard. A lot of times HMOs, you always had to have a EPOs generally don't require a referral for a specialist, but you can't go out of network. And I always clarify that if you're traveling, you're in a car accident, you have a valid emergency, and you have to go to the emergency room, or you're taken to the emergency room, you're always going to be treated as in-network no matter what health plan you have, what state you're in. They have to treat you as in-network in an emergency. So that's the way that is. But I'm saying all our plans right now are EPOs. So it's very important to make sure that your doctors are in the network before we pick a plan. We've run into that sometimes with some plans that great rates, primary doctors in network maybe, but now you need a specialist for something and you're having trouble. You can't find one close by. I mean, you'll find one eventually, but you may have to go to Chattanooga. You may have to go to Nashville or Knoxville to see that kind of specialist with that plan. So that's something we always want to look for. So we need to know, ahead of time when you get the plan, or if you've got a surgery coming up, want to make sure that there's a surgeon close by that can take it, or to make sure the hospital's in network. Because again, if it's not an emergency, if it's a surgery you've scheduled. So those are some things we've got to watch for. So saying that, one of the reasons I bring that up is it's not so much in our area. We have 3 health plans in the Upper Cumberland. There's a couple other companies in different parts of Tennessee, but the three health plans we have here in the Upper Cumberland are United, Ambetter, and Blue Cross Blue Shield of Tennessee. And I stress the Tennessee because Blue Cross is different in different states. That always affects me, especially when the people are moving in. Well, I have Blue Cross. It's like, well, yeah, but that's not our Blue Cross. But the reason I say that about the networks, here in the Upper Cumberland, we're fortunate because Blue Cross in different parts of the states does have two networks. They have the S network, which is the standard network, and then they have the E network. Last year they had some areas where they called it the L network. What I can tell, all the other areas now, it's going to be the E network in that area, and it's usually around the bigger cities. It's going to, around Knoxville, around Chattanooga, around Murfreesboro, and Nashville, and Memphis. You're going to have an E network, and it's usually not just those metro counties, but sometimes the outlying counties also. And because usually the rule of thumb is, it's Blue Cross, everybody takes Blue Cross. Why would I pay more for my Blue Cross when I can have this Blue Cross right here that's so much less money? Well, it's so much less money because not everybody takes it. They've negotiated lower reimbursement rates with select providers and also with select hospitals. So one of the things that kind of fools people, we don't realize, the Blue Cross E network in East Tennessee, it is University of Tennessee. That's the hospital. And so doctors with the University of Tennessee and in around that area, Knoxville, generally will be in network. You get out in the surrounding counties, it's probably not in network. In Nashville, and I got to double check. Maybe I should have done that before I came on today. Hospital is in network with the E network in the Nashville area. One thing I do know, it is not Vanderbilt. So don't use that thought, well, if it's UT, it's got to be Vanderbilt. So it's going to be one hospital network is in network with that plan. So some people, it's going to be a great plan. It's going to be great savings. And I say that because, there may be some people who live a little bit to the east or west of Cookeville that may be listening, that E-network may be a possibility. The good news here for us at the hub here is we don't have to worry about the E-network. We just have the S network. And if you're shopping on your own, it's going to be the last letter of the plan number for Blue Cross. Like Blue Cross may have a B16S, but you go somewhere else where they have the E network, it could be a B16E. Now, the B16E and the B16S are the exact same plan, but they're not the same network. And so that's where they're going to differ. And so that limited network with the E network is going to cost less. Ambetter has some great rates, but again, sometimes the specials. And the same thing with United. The reason I bring all that up is don't say, it's Blue Cross, everybody takes Blue Cross. That doesn't apply with the E-network. The E-network, you have to make sure it is in network. That plan is only offered through the on exchange. So like if somebody's just going straight to Blue Cross, not going through the healthcare marketplace, paying full price for whatever plan's available, then those plans will be, they'll only be the S network or even the P network. You can still get a P network plan if you go directly to Blue Cross, but not through the marketplace. So it looks like I'm running out of my time here. And so as I mentioned, next week we're going to focus a little bit more on Medicare, get back to my Medicare discussions. But until next week, see you on the radio.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.